because of things that I'm sharing. So if you're going to try to record me, please ask permission first. All right. So we're talking about how you study for this course, okay? You have to read that book. You have to know your basic A&P, like if we're covering respiratory. Before class, you need to brush up on the anatomy and the physiology and how everything works normally. So like, let's say the heart. How many of you know how blood flows through the heart? Who knows? Where's it start at?
Right side.
Okay, so it's coming in from where? Where's it coming back from the body from?
The organs?
What's the main vessel that it's coming back from, though?
The inferior vena
Vein.
cava.
Right, the inferior vena cava, and it's dumping into where?
The right atrium.
The right atrium, and then it's going to do what?
Go through that bicuspid valve into the left ventricle.
Go through the tricuspid valve
Tricuspid valve.
into the right ventricle. Now,
Mhm.
why do you need to know that? And is that blood oxygenated or deoxygenated?
Deoxygen.
Deoxygenated.
Deoxygenated. So that's your dirty laundry coming back and it needs to be cleaned, right? It's going into the right atrium and then through the tricuspid valve. Tricuspid valve has three valves. It's on the three leaflets. It's on the right side of your heart. I remember that because tri has three leaflets instead of two. My right side is my stronger side. So how do you remember where the valves are? Because that's going to be very important. When you have to determine what is the cause of right-sided heart failure, you have to know what's on the right side of that heart. So the tricuspid valve is one thing. So it's going through the tricuspid valve, and then you said into the right ventricle, and then where?
Through the
Where?
pulmonary. The pulmonary.
The
Pulmonary valve.
pulmonary artery. So it's going to go
Yes.
through the pulmonic valve and into the pulmonary artery, which is the only artery in the body that carries deoxygenated blood, right?
Mhm.
And now it's going into where?
The lungs.
The
The
lungs.
lungs. And at the alveoli, that dirty laundry is going to get washed and that blood is going to get reoxygenated. And now it's going to come back to the heart. So where is it going to come back to the heart through?
The left atrium.
Through what vessel to the heart?
Pulmonary vein.
The pulmonary vein, which is the only vein in the body that carries oxygenated blood, right? So now you have this oxygenated blood. It's going into the left side of the heart. Where?
Atrium.
Left atrium. And from the left atrium, it's going to go through what?
Mitral valve.
Mitral valve.
The
Left ventricle.
mitral valve or the bicuspid. And then it goes into where?
The left
Left
ventricle.
ventricle.
The left ventricle, and then through
The aortic valve.
Aorta.
the aortic valve into the aorta and out to the body. Okay, so left-sided heart failure can be caused by a problem with that bicuspid or that mitral valve. It can be caused by high blood pressure because the blood is going from the left ventricle into the body. So high blood pressure means we have resistance in those vessels that the heart's trying to pump into. It can also be caused by a left MI. Right-sided heart failure can be caused by a tricuspid valve, a damaged pulmonic valve. By the way, left-sided could also be the aortic valve. So you see why you have to know the anatomy? For this class, you have to know when someone develops something like heart failure or when they develop something like COPD, what is broken and how does it affect the body. Do not spend time looking at treatments, medications. We're not doing that. So stay away from it. You won't see questions on it. But you do have to understand how that body works. So that is that pathophysiology. How does that body function normally when it's broken? What's broken? Why is it broken? And how does it affect the client? So that's usually your signs and symptoms and your complications. And that's what you need to know. All right. So you need to know why. So, like in pneumonia, okay, why do we hear a dull lung sound? What should you normally hear in the lungs?
Air going into it.
What is that air called? If you're a nurse and you're
Oxygen.
auscultating the lungs, what would that
Visceral.
sound be called?
Isn't that with an A? Adventist, something like that?
Adventitious.
Yeah.
So, adventitious is a description of normal lung sounds, but you want to be more specific. So, resonance is typically what we hear in the normal lungs. What do we hear in someone with emphysema or COPD?
Maybe wheezing or stridor.
Hyperresonance.
That-
Hyperresonance, which means a lot of air, because that's what resonance means. It's air sounds. Why do we hear hyperresonance in someone with emphysema or COPD? It's the same reason why they have a barrel chest. Air is trapping in there. So you have extra air, and that's why the sound is hyperresonance. Why is it dull in pneumonia? That's one of the reasons why we know people have pneumonia, but we'll also do a chest x-ray. We'll do a CBC to look at the white blood cell count and things like that. But what would the sounds tell us? Because as a nurse, you haven't done all that yet. You're just evaluating the client. And you hear
They're
these dull
diminished.
lung
Oh, I'm sorry.
sounds. Well, I'm asking about dull ones. Why do you hear dull lung sounds
Less
in
air.
pneumonia?
Can infiltrate.
Is it because of the fluid? Collection
Okay,
of the
so the
fluid?
fluid and the bacteria get trapped in the alveoli and then they solidify. And that gives you that dull lung sound. So you have to know all this when you're listening, when you're palpating, when you're inspecting. You have to know all this. Like, what would it sound like? What would it look like? What would I expect to see in this client? So, what would I expect to see in someone with COPD? They're retaining extra air, but that air is also what? Because what are we supposed to be blowing off?
Carbon dioxide.
Carbon.
Which is an acid. I call it carbon diacid because it's an acid. So if we're supposed to be blowing off carbon diacid and I'm not, what is going to happen with that acid or that carbon dioxide?
It's going to
Respiratory
stay.
acidosis.
It's going to build up in the body. So that's why people with pneumonia or COPD will have a little bit of respiratory acidosis because the gas exchange is impaired there. And then if you look at this slide here, which I'm going to send you, okay, this is the link to the OpenStax book. So if you click on it, it don't want to work for me right now. I probably got to go out of the slideshow. Oh, there it goes. Are you guys able to see it or you still see the PowerPoint?
We see it.
We see it.
Okay, so the book is here. It's a free book. All right, so if you need to look at something A&P, go in here. I'm going to be covering a lot of the A&P as we do the lectures because you need to understand it in order to understand the disease process. All right, so anatomy itself is the study of the body's structures, like the heart, for example. And we just talked about that, right? And now you understand why you have to know the anatomy of the heart. You're also going to have to know the conductive system of the heart, because when we talk about things like arrhythmias, you have to know why is there an arrhythmia, what's causing it, how is it going to affect that person. Physiology is the study of the task, the body structures. An example would be the heart pumping blood that's filled with oxygen and nutrients to send it out to the cells and the tissue, as well as the deoxygenated blood and waste that these cells are trying to remove, or the tissue, the heart is trying to remove from the cells and the tissues. So learn the pathophysiology first. What normally happens? Because if you don't know normal, you don't know abnormal. You have to understand it, not memorize it. So a lot of people will use the cahoots and they'll use it a lot. But when you use the cahoots is really to make you understand the material, but some people will use it to try to memorize. So like when I do cahoots, and I'm going to show you, we'll probably get to some. I don't know if we'll get to some today, but I'll try to get to some at some point this week. I would try to go through all the answers in there. Don't just try to answer the question. If you don't know what the other things on that answer means, then you should look it up. The more you understand, the more you get yourself to look up and review, the better this class is going to go for you. If you skip over words that you don't know or you don't understand, it's going to make it more difficult for you. But really, as a nurse, you have to know this. Make sure you review the material that's covered in class every week. Study before class and after class. You won't be able to cram for this test before the exam. And if you try to, you're going to feel overwhelmed. People will come in here, they'll try to cram, and I see them. When you come in here and you cram for 15 minutes before a test, that's probably all you're going to remember. So do it on a daily basis. Take a little bit of time every day to spend on this. Mnemonics. I use a lot of mnemonics and I use a lot of dirty talk. So if it offends you, I apologize in advance. Cover your ears. I try to make it fun. We're all adults here. If I say something too offensive, let me know. All right. But some of the stuff I say it to you because it helps you remember it. Primary things that you need to know. So for the patho, how does it break the body? Okay, let's talk about type 1 diabetes first. Okay, what causes type 1 diabetes? Anybody know?
You're born with it.
Okay, it's genetics and it's autoimmune. So what does that mean?
That something's not able to bring the sugar down.
They don't create insulin.
Okay, so the autoimmune means that the body attacks itself. And in this case, the body attacks the beta cells. And the beta cells are in the pancreas, in the aisles of Langerhans, and those beta cells are not being produced by someone with type 1 diabetes. So no beta cells equals no insulin. This is why they have to have an outside resource of insulin. So now we're talking about diabetes, and we just named the causes. So the causes of it are genetic, it's autoimmune disorder, and those beta cells are being destroyed. So if someone had type 1 diabetes, what signs and symptoms would you expect to see in them?
Sweating for low.
Okay, they could usually present with either hypo, they're very high risk for hypoglycemia, but also hyper, because they don't have any insulin to bring the sugars down, right? So you could see signs and symptoms for either one, and you should know both. What else? They're usually skinnier, okay? And there's some other things about them. So look up and see what would be a sign and symptom of type 1 diabetes.
Fatigue.
What are risk factors? So for this one, it's really going to be genetics. Okay. And then we would diagnose this basically through like a HbA1c and a couple other tests. Okay. And then what are the complications? So we don't do too much on diagnosis in this class. There might be a couple things we talk about, but mostly you need to know the patho. How does it break the body? The etiology, what causes it to break the body? The signs and symptoms, risk factors, and complications. Do not look at treatments, medications. Right? Like, for example, I might ask you for 3 possible causes of metabolic acidosis, and you would have to try to figure out what could be some of those causes. For patho, I might expect you to know what celiac is, okay? Or what gastritis is. So if you looked at the pathophysiology here, you should be able to tell me what this is. So here we have damage, okay, to the inside of the stomach. We have irritation there, okay. We have bicarb trapping there. So this is going to be likely gastritis. Now I'm going to break it down for you easier than this. Okay, this is just a card you can buy online that I use, but I'm going to break it down more for you. So this isn't something for you to try to memorize right now or try to understand. We're going to go over this when we get to GI, but I just want you to have a basic idea of what would you be expected to know. So now look at the causes: alcohol, stress, tobacco, caffeine. H. pylori is the number 1 cause of gastritis. Okay. And then what would we see signs and symptom wise? So epigastric pain, burning. That would be the more simple way right there of the signs and symptoms. All right. So we're going to look at the abnormal changes in the physical and biological processes. We'll try to look at what's happening in the body when the disease or injury causes the body to react abnormally. Sometimes we can see changes in the way of abnormal labs or lab values. Okay, so for lab values, ones that you should really know are like your sodium levels, your potassium level, calcium level, your pH. A lot of times a person's mental status or level of alertness will change when they're sick. And we might see changes in the physical status, the level of pain, or in their vital signs or their breathing patterns. So patho itself is the study of functional or physiological changes in the body from a disease. This is changes to the normal anatomy or physiology in response to the disease. Can also include the study of the cell and tissue changes. So we do that when we think somebody has cancer. We'll look at the tissue through a biopsy. That's the only way to definitively tell that someone has cancer. But we look at the cells because cells typically change in the way they look when there's a problem with it. Homeostasis is the body's ability to control and regulate things like your blood pressure, your body temperature, and your fluid. So when something's happening outside the body can help with this. So one way the body can help with homeostasis is, let's say you're walking across the Sahara Desert and all of a sudden you become thirsty. You don't have any water. So how is your body going to stop you from becoming dehydrated? So it will start to conserve things. Okay.
Mm-hmm.
So how does it conserve things? So first, osmoreceptors are going to trigger your brain that you're thirsty. And your brain is going to say, hey, wait a minute. This person's really thirsty, but they're not putting any fluid to replace it. So I got to make a move here. So it triggers the hypothalamus because the hypothalamus is your relay center. And it tells the relay center, hey, listen, we don't have enough fluid. Can you get us some more fluid? So now the hypothalamus is going to trigger your pee gland. Why do I call it the pee gland? What's another name for urine? Pee, right? Your kids don't say, hey, mom, I got to urinate, right? I got to go pee. So your pee gland, your posterior pituitary gland, controls the urine along with the kidneys. How does it do that? Through something called ADH, anti-diuretic hormone. So now when someone's in heart failure, we give them furosemide, right? Right, nurses?
Yes.
Why do we
Right.
give them furosemide if they're in heart failure? Come on, you know this. Somebody in here knows this. Why do we give them furosemide if they're in heart failure?
To get rid of
To
the
get the
excess
fluid
Get rid of the
off.
excess
Fluid.
fluid. To
Right,
release all
to
the fluid.
diurese, to get rid of the fluid. So if we're anti-diuresing, what are we doing with the fluid?
withholding those
Within it.
fluids.
We
We're
hold.
holding on
Holding
to it.
on to.
Yeah.
So when the hypothalamus triggers that pee gland, it's going to release that ADH, that anti-diuretic hormone, and that is going to help you hold that fluid, which if you're starting to get dehydrated, then you need to conserve fluid, right?
Yes.
Because if you don't send fluid to certain parts of the body, they're going to be damaged. So your body needs to maintain this homeostasis. So it releases, so the hypothalamus tickles that pee gland, causes that pee gland to release ADH, anti-diuretic, and all of a sudden you stop urinating. What else do you stop doing? You stop sweating. Okay? Anything that's producing fluid in the body is going to slow down or stop. And the body's going to try to hold on to the fluid to maintain homeostasis because it knows it's not getting enough fluid in. So this anti-diuretic hormone can help it hold on to more fluid. Health is typically good when homeostasis is maintained, but when it's not, then disease can develop. And the systems of the body that maintain homeostasis are going to be your nervous system and your endocrine system. Endocrine system we're just talking about with the hypothalamus, posterior pituitary gland, and the anti-diuretic hormone. So there's a stimulus that the body would produce, and in response to that stimulus, so let's say you grabbed the barrel of one of those golden hot curling irons, or you grabbed a cookie sheet out of the oven without an oven mitt, or the oven mitt was broken down and it didn't provide you as much insulation as you thought. So now what's happening to the hand? What's the first thing you're going to feel?
Burn.
Burn.
Hot. Hot. That shit is hot, right? So what are you going to do now? Your body is going to send a message from your hand, okay, through afferent nerves up to your brain. And the brain is going to say, whoa, she just grabbed something hot. In response, the brain is going to do what?
Let it go.
Send back an
Yeah.
an efferent signal, right? And tell you, hey, let go of that crap. So what do? What's your reflex?
To drop it.
Oh.
Yeah, you'll drop it or you'll pull your hand back, right? And all that really happens in a split second. Sorry, my phone's blown up again. Okay, stopped it. All right, so you have the afferent signal. That is the stimulus taking that signal to the brain. And then you have the efferent signal, which is going to bring that back to the body and cause an action to occur. Okay? That's your reflex. So your body really works off of a lot of negative feedback loops as well. Like, for instance, if your body temperature starts to rise, okay? Your blood vessels will dilate. That's going to cause you to lose heat. Your sweat glands will start to produce fluid. The fluid will evaporate, and that will cause the heat to be lost from the body. Same thing if your temperature falls, okay? Your blood vessels will constrict. The heat is conserved. That will cause you to hold on to any fluid from the sweat glands, and your body will start to shiver. And that shiver is involuntary contraction of your muscles. And that shivering is going to produce heat, and that's going to warm your body up. Health is the physical, mental, and social well-being, where disease is the deviation away from the normal structure or function of any part, organ, or system, or combination of those. Homeostasis is that negative feedback loop. So anything that interferes with that feedback can and usually will disrupt homeostasis and lead to disease. So whenever that homeostasis isn't working, or those negative feedback loops aren't working, okay, because of some disruption, then you also are not going to be disease-free. Diabetes is an example of a disease caused by a broken feedback loop involving insulin. The broken feedback loop can make it impossible or hard for the body to bring the high blood sugar back down to a normal range. All right, so when we talk about health indicators, these usually occur within a certain range or value. However, there are certain adjustments that may be made based off of certain things like age, gender, genetics, environment, activity. So, steps that you need to know. These are the steps that you need to know in order to help prevent disease. So these are going to be on your Kahoots. I would know them. You might see a test question on one of these, like, what would be some of the steps, or it might even be a multiple choice to prevent disease. So, not smoking. We don't decrease it, they need to stop. 5 to 10 vegetables a day, servings of vegetables a day, and fruit. High fiber, low fat foods, limiting your alcohol intake. So usually men are allowed 2 drinks, women 1. Physical activity on a regular basis. Protection from the sun, following the cancer screening guidelines, doctor or dentist visits, following the health and the safety guidelines, and also at home when using and storing or disposing of hazardous materials. So my uncle, he brought a bucket in from the garage, and he put it underneath the sink. The sink was leaking, and that bucket he used for painting, he had it underneath the sink, and then the sink got clogged, and he poured Drano in the sink. The Drano went into the bucket, mixed with the chemicals that were in the bucket, and he died from it. So these are the kind of things that we have to make sure people are aware of. Right. So we'll talk about the functional changes in the body that are caused by a disease. We use knowledge, basic anatomy and physiology. We'll look at the aspects of patho that talk about the structural changes in the body tissue caused by specific diseases. And we'll look at the cause and effect relationships that are defined by signs and symptoms. So a lot of the signs and symptoms will sound alike. You got to find specific ones that you're going to, define. Like, let's say you're talking about ulcerative colitis versus Crohn's disease. What's the difference? Anybody know?
Can you repeat the question?
Yes. So when we're talking about effect relationships, these are defined by signs and symptoms. So sometimes you can tell the difference from one versus another based on the symptoms. Okay. So what's the difference between like ulcerative colitis and Crohn's disease?
Is it one can be treated and the other cannot?
No. So let's just talk about a couple of them. And this is how, you're going to try to lay them out and define them when you're looking at different disease processes. So like Crohn's disease is an absorption problem, and they'll have like a cobblestone effect in their intestines. It's all about the intestines because that's where absorption takes place. So everything that is affecting them is more about absorption or malabsorption. They'll have like a softer, mucousy stool, but not usually bloody. With ulcerative colitis, that doesn't affect absorption at all. That has to do with the rectum and ulcers and sores that develop in that rectum. So they're going to have like a bloody mucousy, and they'll have a problem with absorbing things like electrolytes or certain minerals. So those are like just some of the differences between the two of them. So if you know the differences or specific things that happen in each disease process, it'll kind of help you separate them out so that you don't mix them all together. So look for key things that stand out, because let's say they asked you about cancer, a specific cancer. Everybody that has cancer has nausea and vomiting. All right. That's just part of the cancer and the chemo. But then certain things will happen in certain cancers that won't happen in others. So when you can pull out those definitive margins or markers, then it helps you divide the diseases up and recognize them a little bit easier. Prevention of primary focus in healthcare includes activities like maintaining routine vaccinations, participating in the screening programs, community health programs, regular doctor visits. This helps reduce or eliminate the known causes and factors of the for these clients. Okay, so like if we know somebody's at risk for something like cancer, uh, breast cancer, there might be something we could do. First, we could test them to see if they have like the BRCA1, BRCA2 gene. Then there might be something else we can do to help them. We also discovered, a few years back that women that develop herpes or HPV, typically, if they get a vaccination, we can stop that. Okay. So now we're giving those vaccinations to reduce those risks. So there's certain things that we can do to help clients along the way. But prevention is a high focus now. And then you should know these types of prevention: primary, secondary, tertiary. All right, so primary goal here is to protect people for primary prevention. So that means we try to stop it before it happens. All right, so we're doing education here. We're making laws like require them to wear seatbelts and helmets. We'll do immunizations. So all this is to control before the injury occurs or the illness. Secondary is to slow or halt the disease. So here they may already have the disease, okay, and they're trying to slow it down. But also this deals with long-term disability and re-injury. So if you see one of the examples down there is providing suitably modified work for injured workers. So an example would be like maybe you have a guy that works out on the dock and he got injured on the dock and now he can no longer work on the dock, but you're able to give him a desk job in the building. So you didn't fire him and you made it possible for him to still work with his disability. So secondary prevention covers things like taking those aspirin every day to prevent a second MI or a stroke, getting exams and screening for clients with known risk factors, and that suitably modified work for those injured workers. And then tertiary is for complicated long-term health problems like diabetes, heart disease, cancer, chronic muscle pain, etc. All right. Research. So research starts in the lab usually, and we'll use things like rats. Okay. Second stage is going to involve a small amount of people. And so what they'll do is they know there's risk factors here. They'll get a certain amount of people, they'll sign up and they'll try it on them. And for some people, it's not going to work. If it does work, okay, and it's safe, then they go to the third stage. Third stage only happens if the previous stage showed that it was safe. So once we did it on a small number of people, if that showed us it was safe, all right, then we would move on to that third stage. And a lot of times that doesn't happen because, therapy that they determine or whatever is not safe. We also use what we call double-blind studies. In this case, we might give a different treatment to the person versus the actual proven therapy or the therapy that's being tested. So here, they don't really use placebos anymore, but they could use something else besides the actual treatment. And no one knows who's getting what. Person administering it and the specimen do not know, or the subject do not know whether they're getting the treatment or the test treatment. All right. So that way it's called a double blind study. And that way there's no biases. They do this to eliminate biases. Because if I know you got the placebo, or if I know I'm taking the placebo, because sometimes people, if they believe something works, it'll work just because they believe it'll work. And then we also have ethical questions, concerns about this. A lot of people don't like the stem cell transplants and things like that. They consider it unethical. So we will fall into some ethical, legal, and social issues here. All right. So when you assess the patient, you're looking at trying to figure out what's going on with them. Okay. And we're looking at current and prior illnesses. Why do you think we're looking at those?
How to gauge a
So
baseline?
that to determine what type of treatment they will need.
Okay. Or it might
Or
help us determine what they're at risk for or what's been going on with them, right?
Yes.
Okay, allergies. Why is that important?
For medications, to know which medications.
Okay, and it also might help tell us something about what's going on with the person, right? Like if they've had anaphylaxis or seasonal allergies and maybe they're sick, they have a GI issue going on, maybe they ate something or maybe they were exposed to something. All right. And then any type of therapy or drugs, prescription, herbal's important because even though we're not going to be dealing with medications in this course, you as a nurse need to know about herbal products like your ginkgo, your ginger, and your garlic. Okay. I call those the 3 Gs, the 3 gangsters. Why do I call them that? Because if you're taking these products, they can make you bleed. So when someone's taking like warfarin or aspirin or some other product, NSAIDs, that makes them bleed, and then they're taking these products as well, it can put them at a much greater risk. As the RN, you're going to have to constantly update your own knowledge and developments in treatment and recognition. They can occur at rapid rates due to changes in technology. All right. So all the time they're trying to improve diagnostic tests. They're trying to develop more effective drugs. They're developing new technology like robotics, robotic surgery. And then, research, we already talked about this, but research was able to show us that cervical cancer was coming from these infections with HPV. Okay. So by giving these vaccinations, we can eliminate the HPV infection and hopefully eliminate the possibility of someone developing cervical cancer. Make sure you know your terminology. If you don't know a word, look it up. Okay. You have to know medical terminology. If you skip over a word and you see that word on the test, now you got a problem because you don't know what the word means. So you have no way how to answer the question. So do yourself a favor and learn it. A basic understanding of AIP is required here. You have to understand that kidney disease can affect cardiovascular function. And it does that through the renin, angiotensin, aldosterone. How many of you remember the RAS?
I think I do.
Okay, go ahead. Tell me about the RAS. So what happens? You got low flow coming into the kidneys, right? Let's say the person is dehydrated, so they don't have enough fluid in the body. So that's going to make low flow going into the kidney, right? So what happens when that low blood flow hits the kidney?
I think renin triggers that goes to the liver, I believe, and then to the lungs where the antidiuretic hormone, and that goes to the kidneys where, shoot, aldosterone, they didn't tell the kidneys to hold or release the fluids, something like that.
So as the low blood flow is coming in, the kidneys are going to say, hey, listen, this isn't working. This isn't enough fluid coming in for me to push it out to the body. So I'm going to have to take control here and put the body in homeostasis. So the kidneys are going to release renin. Now, what is renin going to do? Renin's going to trigger what there? It's going to trigger the renin. The kidneys will trigger the renin, okay? The renin is going to trigger the angiotensin, and that is a vasoconstrictor.
Right. And then angiotensin 1 goes to the lungs and activate angiotensin 2.
Very good.
And
the
then,
angiotensin 2 is actually the vasoconstrictor, okay?
right. And then that goes to tell the kidneys to then hold the fluids. Right?
Okay. So, yes. And so, how's the kidney going to hold those fluids? What's it going to release?
Aldosterone.
Aldosterone. And that aldosterone is going to help us reabsorb more sodium and more water, and it's going to help us excrete potassium. The kidneys are also going to trigger the release of, anybody else know what else? ADH. Remember we talked about that ADH earlier? That anti-diuretic hormone, because we need to conserve fluid here. So this is a time when that ADH is going to kick in too and help us hold more water. Now we have more water, we have more sodium in water, and we have the power of the vasoconstriction. Because let's just talk about how vasoconstriction works. So let's say that you're in your yard and you're going to water your flowers. Okay? Now, your hose has two things, right? One, it has like a spray nozzle. And when you put that spray nozzle on, let's say you want to spray the side of the house because it's got dirt on it. You pick that spray nozzle, why?
Because it's strong.
It's strong, it's hard, it's powerful. And if you notice, the water's coming out through this tiny little hole, right? And it's coming out really hard out of that spray nozzle and hit the house, which we wanted to do because we need to get that dirt off. Now, if you take that nozzle off, that's your vessel, by the way, under angiotension. Okay? That's your vessel. We want it to be vasoconstricted like that because we need power now to push that blood out to the organs, right?
Makes sense.
Now, when you take that nozzle off, how is that flow coming out of the hose? Unless you put your finger over it, it's just going to flow like a waterfall, right? It comes out the end of the hose and it just drops. But it's a wider flow, right? And softer. So would you take that hose nozzle you just squirted at the house and squirt it at your beautiful roses?
No.
No,
Why?
it's gonna take all
Before
the
they're
petals off the flower.
It's going to take
Mhm.
all the petals off. You know that the same amount of fluid coming out of that hose doesn't change whether you're using the squirt thing. It just comes harder and faster, right? But if you're using that with the nozzle off, it's a lower, slow flow. So now you can bring it over and water those delicate flowers with it, right? And it's a vasodilated hose now, still bringing out lots of fluid. It's just bringing it out at a lower, slower flow. So, these things have to happen. If the blood flow going into the kidneys is low, then your glomerular filtration rate will be low. What is that? Your glomerular filtration rate. What is that doing?
It's filtration.
It's filtration for those kidneys, right? So if it's too slow, what do you think happens? Like when someone has kidney
Retention.
disease, they have that little low flow, right? Yes, retention. And what do you think we're retaining?
Urine.
It's not just urine. What's in that urine that we're
Waste.
retaining? Waste, that nitrogenous waste. And if we retain that in the body, like in kidney disease, that's going to make you sick.
Mm-hmm.
Now, let's say we have a high flow. We were in fluid volume overload. We got all this high flow fluid going into the kidneys. That glomerular filtration rate is going to go up, and it's going to be really fast. So if the water's flowing too fast through the kidneys and the blood, what do you think is going to happen?
Edema,
Overload.
overload.
Well, you already have the overload, so that's causing the increase in the flow. But if the flow is too fast going through the kidneys, remember in the kidneys, what did you say happens?
Filtration.
Retention?
Filtration.
Are you gonna?
Filtration takes time, right? So if the urine goes
Yes.
too fast, it won't be able to selectively take out those electrolytes and things that we need to put them back in the body. Because
I
as
was
that
just
fluid's
gonna
going through,
say. I was gonna say it's not gonna be proper filtration then, right?
correct. So we have to try to maintain that glomerular filtration at a certain rate. And that is going to properly filter that urine, remove the waste that it needs to, and reabsorb the electrolytes, the bicarb, whatever else that the body needs to help it. Again,
So
homeostasis.
either way you're still at risk of retaining the nitrogenous waste. Either way, too fast or too
No,
slow.
if you're spilling it out, you'll probably get rid of the waste, but you won't be able to reabsorb the nutrients.
Got it.
If it's too slow, then you'll retain the wastes. All right. So when we
So,
talk about, go ahead.
so moving too fast is not good for us.
Correct. The urine has to go out at a specific rate. So how
Okay.
many of you have ever done a 24-hour urine test? They do them a lot at facilities where you have to throw out the morning urine and then you collect urine all day in a jug and it sits in a cooler.
Yes, I've done it.
And that's what they're checking is the filtration rate, how well the kidneys are functioning there over that 24-hour period. It's telling them how well those kidneys are working. All right, so when we look at changes in the body, they can occur at the gross level, which means you can physically see these with your eyes, or they can happen at the microscopic level, meaning you need a microscope to see it at the cell level. We could do a biopsy where we take small amounts of living tissue. This is the only way to definitively say that someone has cancer. We could do an autopsy after the fact. Like for people with dementia, this was one of the only ways to ever look at them. Now they're coming up with lots of new stuff, but previously this is the only way that they were able to see anything about someone with dementia because of where it occurs in the brain. You couldn't just open up the head and start looking. We'll look at the causative factors, okay, in the particular disease. So sometimes it's congenital, meaning that they're born with it. Genetics means they have a probability of inheriting it, okay? Not everyone that has a genetic disorder inherits it. So, like, let's say your dad has sickle cell. Does that mean you're going to have sickle cell?
No. No.
You're
You have
gonna
a
have
20.
like half the
They have
trait.
the trait. You could
So you could, but you might not get it at all.
right.
So it's a autosomal recessive, which means your dad and mom would both have to give you a bad gene each in order for you to get the disease. But if one of your parents were a carrier, they could give you the bad gene. You'd have one bad gene, and that would make you a carrier of the trait, but you wouldn't have the disease. So with genetics, it depends on whether they're autosomal recessive, meaning you have to get two bad genes, one from each parent, or autosomal dominant. In autosomal dominant, you only have to get one bad gene. So like in Marfan syndrome, if your mom had a bad gene and gave it to you, you would have the disease because you only need one. We'll talk about that when we get to genetics. Different bacteria and viruses can cause a disease. Degenerative changes in the body, like in Huntington's or dementia. Malignancies, like tumors. Metabolic or nutritional problems. Malignancies. Trauma, burns, environmental factors. All right, guys, I'm going to stop. What's up?
That
Hello?
would be hello, yeah, that would be on my camera.
I need help there.
This is all on your canvas. All you got to do is go to the homepage and open up the calendar for days and scroll down to Ewing.
Yeah, it's not
When
able to schedule. It's not
Excuse
able to
me?
schedule.
Excuse
It's
me?
not. It's not on the schedule.
What's not on the schedule?
The thing I want you to help me with.
What are you asking for help with?
I'm asking you to help me because they're saying that one of my codes is not confirmed, but I did it. I don't know why. It's not showing.
Okay. Are you able to share your screen with me?
Yeah, I can do that.
Wait, I have a question. Are we allowed to leave if we don't need anything?
Yeah, you're done.
when will you post this recording?
Oh, I don't know. The recording has to, first of all, I don't even want all this stuff that's on there.